Safinamide, also known as Xadago, is used in combination with another medication called levodopa/carbidopa to treat symptoms of Parkinson's disease. It can help improve symptoms such as shakiness, stiffness, and difficulty moving, as well as reduce the amount of off-time periods of slow movement or stiffness. Xadago belongs to a class of drugs known as MAO inhibitors and works by increasing the levels of certain natural substances in the brain, such as dopamine. This is important because Parkinson's disease is thought to be caused by too little dopamine in the brain. The recommended daily dosage of Xadago is 50 mg once daily, and it is typically taken in the morning with or without food. It is important to follow the dosing schedule provided by your doctor for the best results. Before starting Xadago, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth, once daily, with or without food as directed by your doctor. The dosage will depend on your medical condition and response to treatment, so do not increase your dose without consulting your doctor. It's important to take Xadago regularly at the same time each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as suddenly stopping may worsen your condition. Also, be cautious of consuming foods high in tyramine, as it may cause a serious high blood pressure reaction. If you experience any changes in the effectiveness of the medication or if your condition worsens, be sure to inform your doctor. When taking Xadago, you may experience dizziness or drowsiness. To reduce the risk of these side effects, be sure to get up slowly when rising from a sitting or lying position, especially when you first start taking Safinamide. It's important to remember that your doctor has prescribed this medication because the benefits outweigh the potential risks. While many people using Xadago do not experience serious side effects, it's important to let your doctor know if you have any of the following: fainting, loss of balance, mental/mood changes, worsening muscle stiffness, or unusual strong urges. Some people taking Xadago have experienced sudden sleepiness during their usual daily activities. If you experience increased sleepiness, do not drive or take part in other possibly dangerous activities until you have discussed this effect with your doctor. Xadago may also increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. It's important to get medical help right away if you develop symptoms such as fast heartbeat, hallucinations, severe dizziness, or severe nausea. Additionally, Xadago may rarely cause an attack of extremely high blood pressure, so be sure to seek medical help if you experience symptoms such as severe headache, chest pain, or vision changes. And as always, if you notice any symptoms of a serious allergic reaction, seek medical help right away. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Before taking Xadago, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. Also, inform your doctor about your medical history, especially if you have liver disease, high blood pressure, mental or mood disorders, eye problems, or sleep disorders. Xadago may cause drowsiness or dizziness, and using alcohol or marijuana can increase these effects. Avoid driving, using machinery, or doing tasks that require alertness until you can do so safely. It's also important to limit alcoholic beverages and speak to your doctor if you are using marijuana. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xadago should only be used when clearly needed, so discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can change how Xadago works or increase the risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xadago include certain supplements, diet pills/appetite suppressants, opioids, and drugs that increase serotonin. It's important to talk to your doctor or pharmacist about any products you are taking that may interact with Xadago. Taking other MAO inhibitors with Xadago may cause a serious, possibly fatal drug interaction. It's important to avoid taking any other MAO inhibitors during treatment with Xadago, and to ask your doctor when to start or stop taking this medication. Before using Xadago, report the use of drugs that may increase the risk of extremely high blood pressure when combined with Xadago, including herbal products, allergy and cough and cold products, and stimulants. Talk to your doctor or pharmacist for more details. It's also important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. If you suspect an overdose or someone experiences serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical assistance. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important not to share Xadago with others. While taking this medication, it is important to have regular lab and medical tests, such as blood pressure and liver function tests. It is important to keep all medical and lab appointments while taking Xadago to ensure its effectiveness and safety. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed one. When storing Xadago, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a place that's not in the bathroom and keep it out of reach of children and pets. When it comes to disposing of Xadago, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the medication when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.